Welcome everybody to this presentation. This presentation is done by علوي الحبشي, PharmD. The title of this presentation is Nanotechnology in Paclitaxel Modification. Nanotechnology is a technology that involves studying particle or atom to make machines and devices at nanometer scale. Nanometer is billion part of meter. To imagine the smallest size of nano, scientists estimate that the diameter of single human hair is around 80,000 nanometer. Also, the width of single red blood cell is equal approximately 7,000 nanometer. What is the advantages from reach to nanoscale? Imagine if we have any matter, for example like this cube. If we divided this cube and continue divided until nanometer scale, these nanoparticles will have new properties, different about properties of the same matter in big scale. For example, silicon elements, as you see, is it has any photonic properties? Of course no. But when we reach to nanoscale of silicon, it will has new photonic properties. And the first scientist discovered this fact was Muslim Palestinian scientist who is Professor Munir Naifa. The most applications of nanotechnology in medical field is in cancer treatment. This is due to the widespread of cancer in the last few years, and it was became the second common disease in the world. Cancer is a group of over 100 diseases characterized by abnormal and uncontrolled cell growth. In a healthy body, cells grow, then die, and replace in very control. If a damage or change in genetic material by environmental or internal factor sometimes result in cells that not die and continue to multiply tumor development, and then these cancer cells supplied with oxygen by surrounded blood vessels. In Washington Adventist Hospital, which is an important hospital in USA, the most types of cancer diagnosed there was breast cancer. And according to World Health Organization, in 2005, breast cancer caused 500 to 1,000 deaths worldwide. How breast cancer occur? Normal breast composed of 5 parts: lobes, lobules, fat, milk duct, and stroma. During pregnancy and breastfeeding, lobules produced milk that traveled into nipples through the duct. Inside those ducts where the most cancer cells began. However, breast cancer may start from any part of the breast. Cancer can spread to other parts of the body by lymph vessels or blood vessels. The movement of tumor cells from breast to other parts of the body is known as metastasis. So, metastatic breast cancer is a stage 4 breast cancer that spread from the original breast site to distant organs like liver, bone, lung, and brain. The National Cancer Institute improved many methods for breast cancer diagnosis like ultrasound, mammography, MRI, and PET scan. In patients who not respond to hormonal therapy or in patients with rapidly progressive disease, chemotherapeutic drugs are most commonly used as palliative therapy. One of the chemotherapeutic drugs is paclitaxel that come from taxane family. The reformulation of paclitaxel into nanoparticles make it 18 times more effective than conventional paclitaxel, and these nanoparticles of paclitaxel can bound to albumin in the same drug formula, and this is lead to discover a new drug which is known as Abraxane. Nanoparticles albumin-bound paclitaxel. Paclitaxel is approved by FDA in 2005 for treatment of metastatic breast cancer after failure of combination chemotherapy or relapse within 6 months of adjuvant chemotherapy. However, Canada in 2006 became the first country to approve this drug as a first-line treatment for metastatic breast cancer. The role of nanotechnology in paclitaxel. Both paclitaxel and paclitaxel act as antimicrotubule agents that inhibit microtubule assembly and cause cell cycle arrest in mitosis. The role of nanotechnology here in the amount of drug that reach to cancer cell. Each nanoparticle of paclitaxel is equal approximately 130 nanometers, which is about 10,000 times smaller than single red blood cell. Once paclitaxel reaches to circulation, it will be bind to GP60 receptors in vascular epithelium cells, leading to formation of cavula that facilitate paclitaxel to reach in large amount in tumor cell. In infusion time, both paclitaxel and paclitaxel are given IV infusion, but paclitaxel is administered in 3 hours. On the other hand, the paclitaxel is administered only in 30 minutes. The dose of paclitaxel is 260 mg per meter square every 3 weeks until progressive disease or until completion of 6 cycles, with 2 additional cycles if a complete response was observed. Pharmacokinetics Distribution. The distribution of paclitaxel is 632 liters per meter square, which is higher than paclitaxel, and between 89 to 98% of the drug is bound. Metabolism. Both paclitaxel and paclitaxel are metabolized by CYP2C8 to one major metabolite, and by CYP3A4 are metabolized into 2 minor metabolites. Drug interactions for both drugs. Certain antibiotics or antifungals like clarithromycin, isoniazid, and ketoconazole inhibit CYP2C8, leading to increase the level of both drugs in the blood and increase the risk of side effects of both drugs. On the other hand, some anticonvulsants like carbamazepine, oxcarbazepine, and phenytoin, all of these drugs are enzyme inducer, lead to increase the metabolite, lead to decrease the level of paclitaxel and paclitaxel in the blood. And according to the side effect, paclitaxel doesn't dissolve well and required solvents to be dissolved and injected. One of these solvents is called cremophor. Cremophor can cause side effects such as difficulty breathing, swollen eye and lips, and severe allergic reaction, which is hypersensitivity reaction. And to avoid this serious side effect, patient must receive steroid and antihistamine drug before they receive paclitaxel. But because nanoparticles of paclitaxel can bind to albumin in the same formulation, this leads to dissolve it more easily. Cremophor is not needed, making the drug much less irritating, and no need to take steroids before receiving paclitaxel. But other side effects are possible with paclitaxel. However, not everyone who takes paclitaxel will experience these side effects. And in case of severe neutropenia and severe sensorineuropathy, the dose must be reduced from 260 mg per meter square to 220 mg per meter square. And for recurrence of severe neutropenia or severe sensorineuropathy, additional dose reduction should be made to 180 mg per meter square. Warning: both drugs should be administered under the supervision of physician experienced in the use of cancer chemotherapeutic agents. Should not be administered in patients who have baseline neutrophil counts of less than 1500 cells per millimeter cubic. And don't distribute paclitaxel with other paclitaxel drug. Pregnancy category. Both drugs are pregnancy category D. That means there is positive evidence, but potential benefit may outweigh potential risk. And in nursing mothers, it is not known whether are excreted in human milk or not. And according to the price of paclitaxel is $150 per 1 dose, and the price of paclitaxel is $4,200 per 1 dose. These are my references, and finally, I would like to acknowledge everyone who helped and support me to do this work. Thank you very much.